Hello everyone. I am Dr. Mohan Raut.
I'm Dr. Mugdha Raut.
We are gynecologists and clinical reproductive immunologists. We have our centers, Dr. Raut's Centers for Reproductive Immunology, in different parts of India. That is in Mumbai, Pune, Nagpur, Bangalore, Hyderabad, and Delhi. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility. Using immunological treatment of lymphocyte immunization therapy or Imulit, which is a patented process, and other immunomodulatory medications. We feel that along with the regular treatment of fertility related problems, the couple also suffers with lot of emotional and psychological problems. And it is very important to address these problems in the right way. And therefore, we have started this special series, Coping with Infertility. So, and we have our special expert here with us, Dr. Akshata Bhatt. Hello, Dr. Akshata.
Hi, hello.
We see the pain in the eyes of the couples going through this journey, which deeply affects a patient's side. The emotional toll, fear of never becoming a parent, and the societal pressures can be overwhelming. Seeking hope and emotional resilience therefore becomes essential. Understanding this struggle is a key to providing compassionate care and support. Here, we are planning this live series every Wednesday on how to navigate this journey with the help of a passionate mental health advisor, Dr. Akshata Bhatt. Dr. Akshata Bhatt is a consultant psychiatrist in Vileparle East, Mumbai. She has extensive experience across public and private sectors. She specializes in treating mood disorders, schizophrenia, and substance abuse while actively promoting mental health through workshops and social media. Dr. Bhatt is passionate about raising awareness and ensuring mental health, especially in couples with reproductive failures. Today, we have the third episode titled The Role of Therapy and Counseling in Infertility. You can see the first two episodes on our YouTube channel, Dr. Raut's Center for Reproductive Immunology. And don't forget to like, share, and subscribe to our channel. Knowingly or unknowingly, you may help a couple complete their dream of having a family.
So, welcome, Dr. Akshata.
So, Dr. Akshata, when we have seen the previous two episodes, which have been a huge success, we start with the role of therapy and counseling in infertility and reproductive failures also. So, first question, let us start with the basics is, how can therapy and counseling specifically help individuals and couples also deal with their reproductive failures?
So, hello, and today we are talking about therapy and counseling in infertility. So, first question, like you asked about therapy and counseling, how it can help individuals or couples. So, that is very important that there is help available for individuals as well as for the couple itself. Okay, and I think both are very, very useful in this situation. So, when it comes to couples counseling, for example, it can be used to navigate all the emotional challenges that they are going through. It is very common because this is a long process. This is a marathon. It's not a sprint. It's very common for couples to have disagreements, to be angry, to be frustrated, to be upset with each other. And these emotions are going to come up. It's natural. We cannot say that you should not be angry, you should not be sad. All of these are human emotions. Everything comes on a spectrum. And what is important here is that when you feel sad or angry or frustrated, how do you express it? That is more important. So, with therapy, you will learn how to express these emotions in a healthy way. That is the basis of therapy. That is what we learn. That how do I learn how to channel my anger, or how do I deal with my anxiety in a more healthy way? So, when it comes to couples, it can help them overcome the emotional issues that they are facing individually or together. The best thing would be if they went for individual therapy and for couples therapy so that all the issues that they're facing can be addressed together. And as far as individual therapy is concerned, there may be things that they have a hard time telling their spouse or even their close friends and family, which is when the role of a professional comes into the picture, because then they have access to somebody who is non-judgmental, who is objective, and who will keep everything confidential, which is also very important in this condition.
So, Dr. Akshita, you mentioned about some condition and what the feelings of the couple are. But could you just enumerate for the knowledge of our viewers what are the common emotional and the psychological changes which the couples face during this infertility journey? During this marathon which they are going through.
So, given that it is a long and a drawn out process, it is exhausting. It takes a toll on you emotionally, it takes a toll on you mentally. Physically, also, there will be a lot of changes because there'll be a lot of medications or injections that the woman will be taking. And all of that also causes a lot of mood symptoms. It's very common to feel tearful, to constantly feel anxious, to feel like you're going to cry for every small thing. So these are changes that they are not able to control. That lack of control over emotions becomes very difficult. Other than that, because it's a long process, when will this happen for me? Will this ever happen for me? The apprehension, the anxiety about when it will happen. Then, as we've been discussing in the last couple of episodes, the role of family. Sometimes it can be that the family is the biggest source of stress because they keep asking the couple that when are you going to have a kid? It's not uncommon. We've seen this ourselves in social situations where people ask, good news kab aa raha hai? So that leads to them wanting to withdraw socially from people as well. So here, the range of emotions would be anything from sadness and anger to frustration, disappointment with themselves, with their partner, having that sense of guilt that I'm not able to do this. This is something that billions of people all over the world are doing, but I'm not able to have a child. Sometimes there can also be a lot of grief because in repeated miscarriages or IVF failures, there is that grief that I have lost a child. And it also depends on how everyone interprets this in a different way. For some people, it is actually the loss of their baby. It is actually the loss of their child, the one that they were going to have. So this is the range of emotions. You can also have a lot of jealousy directed at other people that, they have families, I don't, or they are doing so well, or they managed to conceive in the first or the second cycle, and we are on the fifth or sixth cycle and nahi ho raha hai. So jealousy, anger, resentment, basically it's a huge spectrum of emotions. And because we are human, we feel a huge variety of emotions. So any of these can happen.
So all these emotions definitely must be impacting their personal life, their family life, or their social life. So as a management or to take care of that, as a first line of thing, do you think a counseling plays a major important role even before taking the therapy?
So, counseling would be a very good idea to start because it will help you outline what your problems are. You'll get an idea of where you are right now, what you have to do. You'll get kind of like a plan of action that how do I proceed with this. For example, when you are counseling about infertility, you'll be explaining to the couple what their options are, depending on the age, depending on the medical condition, that these are your options, this is your possible success rate, things like that. So here basically it's a source of information. You're giving them a space to ask questions because these are the kind of questions they will not be able to ask their friends or family members. So you give them a space where they can ask you anything rather than relying on people who don't have enough information or looking it up online, which may not always be accurate. So giving someone a space to ask questions with the freedom of the fact that nobody is going to judge them. Nobody is going to feel that, oh, this is a dumb question, you can't ask me that. So having that unbiased atmosphere where they can express themselves would be a great idea. Now, in counseling, there will be a assessment also done. So depending on what the symptoms are, depending on if they have any specific condition that can be diagnosed, then they can be recommended for specific therapies. So it would be a great idea to, go in for counseling and get an idea of where you stand.
Regarding counseling, I think there is one more point I would like to make here. is many times patients say, "Oh, I have our doctor has done the counseling part,"
Mhm.
and so exactly what is counseling is many times they don't have an idea, or who should be doing the counseling, or who where they should go and seek counseling. So these things also many times people, the couple is not aware. So I think, can you tell a little bit more about it? Exactly who can do, who should do counseling, and what is expected of it? That many people feel counseling means they will tell you to do one, two, three, two, three, these 10 things you should do, then you will be fine. So is that counseling? So I think, can you share, throw more light on this, because it is very loosely used term, counseling.
Yeah, exactly.
Very loosely used term. And what Sir said is a very telling thing. Who can do and who should do. Can do, matlab everybody can do. In India, everybody can do counseling. Aate jate hue, people will give you advice about your life, your career, everything. They will tell you without asking. Okay. So can, matlab anybody can. Should, it should be with somebody who is certified, who has experience, who has done a degree in either in counseling or in mental health or in psychiatry or in psychology, someone who has experience. People assume counseling matlab tum jaake gappe maro doctor ke sath and they give you a big bill. It's not like that. Everybody feels like that because the atmosphere is set in a way so that the other person is comfortable to open up and talk. But actually, we are also identifying what are the potential problems. People will feel that, the questions are so casual or they're so simple. Ye to main bhi kar sakta hu. It's not uncommon for me to hear this from parents when they bring their kids for counseling or something. Oh, this to even we have done at home, or this to even I have told them. But they don't listen to me. That's the point. Na? They don't listen to you. That's why you've come to someone whom they will listen to. So counseling is a term that is thrown around a lot, but from the official point of view, I would say it is giving information about the condition, getting them to understand what is the prognosis, what is the diagnosis, what are the long term implications of your condition, how you can manage it. Okay, so basically, giving an overview of the condition is what we would say what we do as counseling, giving an idea about what the condition is, how you can manage it, what can be the long term and the short term issues that you are going to face, and what can be the recovery that we can expect in this condition. Therapy is very specific. So it would be therapy is for a very specific condition. For example, we use cognitive behavioral therapy in treatment of depression and anxiety. So it is specifically targeted for those conditions, or dialectical behavioral therapy in case of borderline personality disorder. So those are specific therapies depending on the diagnosis.
So I would like to ask you, ki in the perspective of reproductive failures, do you think that it is like a blanket treatment for everyone? Or because, like you said, there are various emotions which the individual and the couple go through. So, do you think each couple should be given a different kind of counseling, a different kind of therapy? What are your opinions on that? Like, or it is a this like, okay, this is reproductive failure, we need to work like this, or it is no, it is different. It's different for every individual.
So I'm a 90s kid, and for those of us who went to college around the early 2000s, at that time, एक top trend में था, which when you go to the shop, he will show you and say one size fits all. He says anyone in the house can wear it. It's stretchable, and anyone can wear it. Therapy and counseling is not like that. One size does not fit all. There is no blanketed approach to this. It's the same as any other medical condition where you will diagnose the person and see what is wrong with them. Okay, what are their symptoms, whether they need medication or not. Also, see, there are a lot of other factors also that come into the picture. For example, how receptive the patient is for therapy. That is very, very important. People tend to feel कि डॉक्टर के पास लेके आए ना, they will say अभी आप काउंसलिंग करो और उसको ठीक करो. No, the person also has to be receptive, because it's not just as simple as you tell somebody, they will say ha 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 and their life transforms overnight. It's not like that. You have to be receptive, you have to be willing to participate. If you are not willing to do the work, then therapy or counseling is not going to work for you. It's not something that is going to magically happen. You have to put in the effort for it, you have to be receptive towards it. So in this case, what I would say is that counseling and therapy works wonders, but you have to be willing to put in the effort. And you have to go to an expert who understands that this is what is going to work for you. This approach will work for you. When you talk to different people, you understand that the same approach does not work for everyone.
So, doctor, is the counseling will always take care of all the problems, or it must always be followed by therapy? Means, what do you think? The counseling, will it take care of patient's problem, or after counseling, patient has to take a therapy?
Or they have to take therapy and not counseling. So, means like in the last episode, you mentioned that, they said they are in their shells sometimes, the infertility patients. And now you told us about there is a range of emotions which they are facing. So, how do you classify which patient would require counseling and which would therapy, or how way means first counseling, first therapy, or therapy first, then counseling, or both together?
So the chronicity of the condition, that is how long they've been having the symptoms, the severity of the condition would determine how much of therapy they will require. Usually counseling can be long-term, can be short-term, same goes with therapy. Usually someone with more severe symptoms or more problems would be going in for proper therapy where it is, depending on how much improvement they show in each session. Same goes for medication. In some specific conditions, when the severity of the symptoms is a lot, then yes, medication also has to be considered over here.
So, after counseling, then we have heard that there are different types of therapies. So, is it that which therapy is for which patient? Is it something like that you decide, or how do you go about to decide about which therapy will be required for which patient? Because there are different types, I suppose, right?
So one of the ways to understand that is also to undergo psychometric testing. So there are a lot of personality tests that can be done. There are tests for specific conditions, or you have scales which tell you the severity. For example, Y-box is something that will tell you the severity of OCD, obsessive compulsive disorder. So using scales and testing, you get an idea not just of the psychiatric conditions, but also of the personality issues, if any, that the person is suffering from. So when we get a complete idea of all of these things, then we can proceed for specific therapies. The point here being that someone qualified takes a detailed history, understands what the patient is suffering from, understands the background. We generally ask a very detailed history about them growing up and, what kind of personality they have, how they mix with people, things like that. All those things are relevant, and taking everything into account, like a full view of it. And that is when we'll decide which therapies to go for.
But which therapies are usually useful for couples who are facing fertility problems? Is there something like that, the particular therapies will be useful for these couples, or?
So again, it would be a very customized therapy session depending on the needs of the couple. For example, if they're also suffering from personality disorders individually, so it would be helpful for them to go for individual therapy, like I mentioned, dialectical behavioral therapy for borderline personality disorder. Or if they're having problems by themselves of anxiety and depression, then CBT, cognitive behavioral therapy, would be a great option. So these are just examples I'm giving of different therapies that are available. Usually your therapist or your doctor or your psychiatrist will be the best one to tell you which would be required for the specific condition at the moment.
Like this brings to the next question. When they come as a couple, right? Many times they come as a couple, their relationship has gone for a strain sometimes. So do you think therapy will help to rebond their relation and remove the strain between them, where infertility is concerned? See, otherwise in other aspects they could be really a very great couple, but where fertility is concerned, it could have strained their relationship. So do you think counseling will help to change this situation? Counseling and therapy, I mean both.
So with couples counseling, what happens is a lot of the issues that they have not been willing to address, a lot of times they will refuse to talk about sensitive issues among themselves also. They're aware. A lot of times they are very much aware of what is happening, but it is just too difficult. So by giving them a space where there is somebody to moderate or overlook what they are talking and work on specific things, they get a space where they can express themselves and they can talk about what is really bothering them. So starting from there, I think couples counseling is a great option in these situations because again, it's both of them who are going through it. It's not just any one partner. And both of them will have things that they want to express, that they want to discuss, that they want to uh, air out, if they have any differences or anything. And obviously, we know that in every relationship, there are ups and downs, those things are going to happen. So, expecting ki everything will be perfect just because we go for counseling is not the way out. The point here is you learn to navigate the ups and downs. You learn that we have conflict, but we will resolve it in a healthy way. We have problems, we have issues, but we will work on them. We have difficulty setting boundaries with family, but rather than saying ki your family is bad or trying to defend your own family, you work on setting boundaries with them. So the point is to be more solution oriented, not problem focused. You have to start being solution oriented. That situation aisa hai, how do we make the most of it?
One situation comes to my mind. Do you face problems where the couples are bitterly fighting with each other in front of you?
It is very common. A lot of times I actually have to tell them that I'm not a referee. Okay. This is more like, what happens in a football match when both the teams get to each other. So I have to tell them that A, I'm not a referee. B, I'm not a babysitter. Okay. So please do not throw tantrums here. Sometimes I've actually had to separate them and talk to them separately because things are so bad that one of them will not let the other person talk. So they'll just keep shouting at each other instead of getting to the point. And then you have to keep telling them that, listen, this is not a good use of the time that we have together because we are not getting anywhere. तुम घर पे भी झगड़ा कर रहे हो, इधर आके भी झगड़ा कर रहे हो. The only difference is I'm getting paid for you fighting over here. That's literally the only difference. So I generally try to talk to them separately and together. When things are a little bit better, yes, talk to them together. But yeah, it's a very common thing. It's a very difficult thing to deal with. And we generally have to tell them in advance that, please don't get into ugly fights over here. But hota hai, bahut baar hota hai.
One more question. When these couples go through different types of fertility treatments, so say IVF or sometimes even adoption, and also does this counseling and therapy play an important role in helping the couple maybe to make their mind, because many times they are confused and we tell the biological things or the medical things, but still there are many queries. So what is the role of a psychiatrist or through counseling and behavior to help these couples?
Because, one thing which we have heard very often is that they become very guarded, even for the first sonography, the subsequent sonography, you don't want to tell anyone. And that is one, they can't even feel that happiness after a fertility treatment has succeeded. They're so used to the sadness. And like, even if they have conceived, pregnancy is going on fine, you can see the depression on their face when they're trying, or the anxiety that will the baby be fine? Will I deliver normally? Will I get a baby in my hand? So their acceptance levels are so low, their depression, because they're not able to accept that this can be true. So that's why we think of this issue that, how does a counseling, how does this therapy work in these patients?
So coming to what Sir said about adoption or other options. So I think the biological part, the reproductive part is being taken care of the experts. That is both of you. So you will be explaining what are your options with respect to the age, the medical condition, previous success rate, etc. I mean, you know how complicated it is. It's a very, very vast thing. And that is where you guys are qualified to explain. Now, when it comes to exploring options outside of this, like adoption or other things, we have to also understand that there are a lot of other challenges that come along with it. There are legal issues that have to be looked into, which would require you to talk to a lawyer who is well versed with adoption and with the challenges, the legal hurdles that can happen. Also, there is, how much ever we may admit it, there is a psychological change that is going to happen. Okay. In any house with the entry of a new member, the dynamics always change between the family members. So in this case, we have to acknowledge the fact that however open-minded we are, this is going to happen. This is just a part of life. So, for example, with adoption, you will have to take into consideration things like how will the existing family members uh, adjust with the new child? How will you announce it to the rest of the family? How do you plan to disclose information? All of this has to be thought out a bit so that it's a little healthier and easier for the parents as well as for the child. And what is the long term toll of having this arrangement? Is it going to have some toll on you or not? So I think having that openness and honesty is helpful, but it should also be the prerogative of the family, especially the couple, how much they want to discuss and whom they want to disclose things to. Okay. Coming to the second part of what Madam asked regarding the apprehension that people feel even after conception, and that constant fear. I think what happens with them is it's a long process. They've already been through the failure once. They already know what it is like to lose the conception, to lose the child in that situation. So that fear is very understandable. They would feel really sad and scared and anxious. And I think it is a very difficult situation. So having somebody being supportive, being empathetic here would be helpful. So one of the things we had asked was what is the difference between a family member and a professional, right? In one of the sessions. So with your family members, you will get a sympathetic approach, but with a professional, you will get an empathetic approach. And that makes a big difference, because in a lot of times in this situation, people need empathy. They need someone to say that, we understand what you're going through. Not, I feel sorry for you. I feel sorry for you may not have a very big place here. Sympathy is, I will feel sorry for you. Empathy is, I will make an attempt to understand what you are going through and hold space for you. So here we need more of empathy rather than sympathy.
Yeah, because many times we see, like the mother or mother-in-law will say that, or even the husband, we keep telling her, be happy. But we see the wife who's going through so much suffering and she cannot be happy. It's a fact, it's an accepted fact. And then they say, no, we'll read the holy scriptures, we'll do this, we'll do that. You should always think positive, read positive books. But in her mind, she really needs someone, as you say, someone who's empathetic, who is going to understand and help her just vent it out, understand what she's going through, and uh, she should be getting a solution out of it. So that I think will play a long way in even the success of the pregnancy and making them feel happy that, oh yeah, finally I have succeeded. So now, that happiness of being a mother is lost in that whole process.
So feel that telling someone be happy is, I think, very, very insensitive. Just saying think positive, positive सोचो, अच्छा सोचो, be positive. असा विचार करूच नको, चांगलं विचार कर. If it was that simple, then we would be out of work. One thing is that, and everybody would be happy, right? I mean, if being happy is not something people think of as an option. Everybody wants to be happy, right? Option है क्या हमारे पास नहीं है, that is why we are sad ना. So I think it's very insensitive to tell people be happy, be positive. And I don't know if you've heard of this concept of toxic positivity, where you do not acknowledge that the other person is going through something difficult. You just say stuff like, hey, be happy, be positive, things will work out at some point. Here it is important to acknowledge that they're going through something, and you cannot fault a person for having a human emotion like feeling sad. That's a very, very human emotion. We should not be telling people don't be sad or don't be, don't have such thoughts. It's not in their control. They are feeling sad. Better to acknowledge it rather than trying to get them to suppress it. Let them acknowledge it. Let them express it in a way that is good. We should encourage them to express it in a healthy way rather than suppress it and then it comes out later in other ways,
There is one more thing, Dr. Akshata, I would like to ask. See, when the couple is taking treatment for fertility, as they are anxious, they are under stress, but there is one more emotion which they face very often, and that is when they lose a pregnancy, or when the IVF fails, and that grief, especially when they lose a pregnancy, and that grief feeling can be killing. So in which way the counseling or the therapy will help these patients who are going through the emotion of grief?
So here I'll just tell you a very small story. This happened to a patient of mine. She had conceived and she had a miscarriage. And she was feeling sad about it. It was not a planned thing. It was not, they were not planning anything at the moment. It happened spontaneous. There was no reason for it. And she felt sad. But, someone in her family, someone in her in-laws basically told her, what are you getting upset about? It was only 1.5 months. It was only a mass of cells. I remember this phrase because even now this is a very old story because the way they phrased it, it was just a mass of cells. And when she told me this, and she was just telling me that this has been very difficult for me, even though we had not planned it, everything was unexpected. The conception, the spontaneous miscarriage, everything was unexpected. And she was very distraught about it, understandably. And she said, this is what they said to me. It was a mass of cells. And I mean, someone telling you in such a insensitive and minimalistic way that why are you getting upset? This was nothing. No, for them, it is the loss of a child. You have to let them process it in the way they can and the way that they want to. And as you might have heard, that there are stages of grief. There is denial, anger, bargaining, depression, and acceptance. Now, the common thing is that when there is a loss, usually we relate this to death. Now, here also, it can be taken in the same context because it is the loss of a child. And you will go through all those stages. It's not necessarily that they go in a sequence. There's generally a lot of overlap, and you can always regress or progress into any stage at any time. But we have to acknowledge that this is what they are feeling, that this is what for them it is a loss. It is a huge loss. They are going to grieve for it. And you have to let them grieve. The more we suppress our emotions, the more we suppress our grief or our anger or our resentment, it is going to come out and harm us only in very different ways. For example, somatic symptoms. It's a very common understanding that all the emotions that we try to suppress, they come out as somatic symptoms, either as body pain, headache, or anything like that. So suppressing emotions is not the way to go. And this is not something we should encourage with other people as well.
Dr. Akshay, many times the couples who are facing this fertility problem, they are aware about their psychological struggles, emotional struggles, and they want to take help also. But they are in a dilemma whom to approach, where to go, who is the right person. So can you please tell more about this? That will definitely help them make their decision.
So I would say first thing, always check up the qualifications of whomever you are consulting. I think that's a very basic question you should ask. If you are not sure, please ask. There is no harm in asking. You should know what you're getting into. You should ensure that your treatment, your mental health is in the hands of a certified professional. So depending on whether it's a psychiatrist, whether it's a psychologist, whether it's a counselor, ensure that they have the right appropriate qualifications. Someone with experience would be a boon because, someone who's seen multiple cases, so they will know better how to handle it. Okay. Also, on an individual basis, like this is the formal therapy part of it, but on an individual basis, when you meet the therapist, the doctor, the psychiatrist, or the psychologist, someone that you feel you resonate with, someone whom you feel is empathetic, is able to understand what you are going through, has an idea or has dealt with patients like this before, they have some amount of experience and understanding in this situation, that would be a good fit, someone who gets what you are going through and at the same time is qualified to give you advice.
Now that you've told us about how to choose the right person to give you the counseling, one very important aspect I feel of in our culture, our society is that they face a lot of societal pressures. So can you just tell how can therapy support the individuals who feel overwhelmed? They feel overwhelmed by the societal, the cultural pressures related to starting a family.
So, as I keep saying, that Indian society is very poor with boundaries, and everything that is your private business is actually everybody's business in this case. So, I think that becomes very difficult because in Western countries, these kind of pressures are not there. It's not very common there for entire families to stay together or even ask questions about day-to-day life. Whereas here, everyone knows everything, you know. I remember one of my patients who when they were staying with the in-laws initially telling me that there was some amount of friction which is expected in every house. And then she said that we've moved abroad, because of his job and everything. So I said, okay, so things must be a little bit better, right? The friction between the in-laws. And she says, no, my mother-in-law believes in long distance nagging, you know. So then she'll call her on WhatsApp and on video call pe nag karenge, tumne ye kiya kya, wo kiya kya. It's not ended basically. So this is the kind of society and cultural issues that we are dealing with. So in therapy, apart from being able to express your frustration, your sadness that nobody gets what we are going through or they don't understand, you'll also learn how to be more assertive. You know, you can start telling people that it's not okay for you to ask me these questions. You will build up the confidence to say no when somebody says, hey, can I ask you a personal question? Or when people ask, when are you bringing the good news? You can say that, this is not the right time or the right place for you to bring it up. This is a personal issue. So for a lot of people, being able to say no is very difficult. Being able to assert themselves is very difficult. And with a good therapist, you will learn how to express yourself. I'll be very clear. The point here is not to get into conflict. Okay. It is to stand up for yourself. You can stand up for yourself and be respectful towards the other person and resolve this whole thing in a very healthy way. Okay. So that is what another thing you can learn from therapy, how to be assertive, how to stand up for yourself, and how to take more pride in your own identity.
That will definitely help them take care of these emotional turmoils that they're going through in this treatment of fertility. So thank you, Dr. Akshata, for an excellent session. I think you nicely explained the importance of counseling as well as the therapy for couples who are facing the problem of fertility along with emotional and mental problems, and how this therapy and counseling can help them take care of this emotional turmoil.
So thank you once again. And to all our viewers, stay tuned for our next session on mindfulness and meditation. And don't forget to like, share, and subscribe to our channel. Knowingly or unknowingly, you may help a lot of